alarming list of 12 medics who have all died from the coronavirus in just a week. The deaths denting an already struggling health sector whose workers are threatening to down their tools in 2 weeks' time if nothing is done to change the worrying trend. Timothy Otieno now reports.
The news of the death of the 64-year-old senior doctor who served as the president of the African Association of Nephrology and deputy director of the East African Kidney Institute does not come easy for the over 7,000 medical doctors in the country who have been on the forefront in battling a global pandemic. Dr. Anthony Were passed away at the intensive care unit of the Nairobi hospital on Saturday morning after battling the virus for more than a week. His death, announced on social media by the Kenya Medical Practitioners, Pharmacists and Dentists Union, came just 3.5 hours before yet another medic would succumb to COVID-19. Celebrated dental surgeon Dr. Neera Patel, also killed by a virus, which has now claimed the lives of 12 frontline workers in just 10 days.
Daktari, thank you so much for speaking to KTN News.
It's a situation the country's doctors' union say may hurt rather than help Kenya's fight against a second wave of the coronavirus.
With every single death of a doctor, then the doctors on the ground feel demotivated, and they feel demotivated and scared because it could be them, it could be any one of us. But more importantly, the fact that up until now, it's not clear how you get compensated, how you get treated. There's still medical bills to be catered for.
It's for that reason that the doctors' union issued a 21-day strike notice, which lapses on the 6th of December. In the strike notice, the medics are agitating for improved access to personal protective equipment and a comprehensive healthcare package, among a growing list of concerns for Kenya's medical fraternity, which on Wednesday this week drove some members of parliament to tears over the manner in which the doctors were being treated.
I don't like this.
All right, easy.
You can't do that to your doctors and your health workers. It's not fair. It's not fair.
But for the 32 medics who have died from the virus since March this year, the empathy comes a little too late. Already, the Kenya Medical Practitioners and Dentists Union are sounding a warning over the lack of effective directives meant to resolve the growing concern.
The issues that we had brought forth in our strike notice are yet to be resolved. So just know that with every death, doctors are fast losing their morale.
Our healthcare workers are also part of the community, and that you cannot tell whether a healthcare worker got infected in the hospital or get infected in society where they actually, where they normally reside.
I want to urge the government, the Ministry of Health National, to at least endeavor and give full medical cover for all frontline medical workers.
5 months after the country lost its first medic to COVID-19,
I am Adisa.
doctors launched a rigorous campaign to push the state to offer them meaningful assistance in the global fight. But with more deaths and little solutions, could the concerns by Kenya's medics be falling on deaf ears? Timothy Otieno, KTN News.
Heartbreaking. Let's now look at the latest COVID-19 numbers. Kenya has today recorded 1,211 new cases.